Are statins safe in MASLD and MASH?
Statins are safe and effective in patients with MASLD and MASH. They significantly reduce cardiovascular morbidity and mortality and do not worsen liver histology. Mild liver enzyme elevations seen with statins are typically transient and not predictive of hepatotoxicity. If a patient meets standard criteria for dyslipidemia or ASCVD risk, statin therapy is indicated regardless of fatty liver status. So when should we not start or at least press pause on statins? If the patient has decompensated cirrhosis, you want to avoid or use statins very cautiously. There's limited safety data here, and the risk of hepatotoxicity becomes more relevant. Next, in the setting of acute liver failure or active hepatitis, hold off until those liver enzymes stabilize. This isn't the time to be introducing a statin. What about elevated transaminases? If the ALT is more than 3 times the upper limit of normal and there's no urgent ASCVD indication, take a step back. Evaluate for other causes first. Once things settle, you can think about reintroducing, and then, if there's severe statin intolerance, pivot to alternatives. Options like ezetimibe or PCSK9 inhibitors are on the table, and you can always consider a cautious rechallenge later on. Key points to keep in mind. Statins don't worsen liver histology. There's no need for routine liver function tests after the baseline check, unless something clinically points you there. And the big picture. MASLD is a cardiovascular disease equivalent in many of our patients, so the mortality benefit of statins far outweighs the risk in most cases.
Listen to Endo in a Bite on Apple Podcasts, Spotify, or YouTube.